If currently you're an inpatient on one of our wards, then you'll be given information about the procedure and have the opportunity to speak to nursing staff and medical staff about what's going to happen to you. On the other hand, if you've seen myself or one of my colleagues in clinic, then the next stage will be to visit the pre-admission clinic. Hester is one of our pre-admission nurses with over 15 years experience. Her job is to get you and us ready for your procedure.
Once it's deemed appropriate that the patient requires an angiogram, they don't have to wait too long nowadays, just a few weeks. We write to the patient and invite them to come along to a pre-admission clinic, which is usually one morning or one afternoon, just for a few hours, just to discuss all the details of the procedure and have them and prepare them for the actual angiogram. Once the patient arrives in the cardiac centre, the first thing we do is we just get an ECG on them, and they will have had an X-ray downstairs, and then they just need to sit outside until I call for them, and then I invite them into the office to begin the interview. So, and of course you've had one before, haven't you?
I had a stent put in. I was getting angina, so I had an angiogram which found out which particular artery was giving the trouble, and they put a stent into that, and that gave me a new lease of life.
The purpose of the pre-admission clinic is to discuss all the practicalities of the admission, to make sure the patient feels happy and relaxed about the whole thing. A lot of them are very anxious prior to this, and hopefully we can make them feel a little bit better about the whole process. Sit by the desk there. The patients are welcome to bring somebody with them. Sometimes it's nice to have somebody in here with them just for reassurance, and also to absorb some of the information that we're going to give them. The pre-admission takes about 40 minutes to do. I check all the patient's drugs and record them all. I ask the patient some clinical questions, just about past medical history. I like to know if any symptoms have changed since they were last seen here, either at the treadmill clinic or by a consultant.
I've had problems lately, especially in breathing. I know I've got a problem, but I hope it's not a heart problem. It's a lung problem I've got rather than a heart problem. I've worked in the building trade all my life, and I think it's dust from the building trade that caused it.
And have you got any family history of heart disease, your siblings or parents?
No.
Right. We have a discussion about the whole procedure itself, so I run through the procedure with the patient just so they know exactly what to expect on the day. Okay, so we're going to inject some dye down these arteries of your heart. You can better see it on this model. So you've got these three main coronary arteries, and they all supply the heart muscle with the blood that it needs to function normally. But obviously if there's some furring up in these at any stage, it can cause a deprivation of blood to the heart. That's what causes the angina and the chest pain. So we'll just inject a bit of local anaesthetic into the top of your leg on the day just to numb it, and then it really is a very tiny nick. It's about that big, and it's just into the artery under the skin, and then we just follow the artery up with a catheter inside of you, check their blood pressure, pulse, height and weight, and then hopefully answer any questions that are outstanding. And I give them paperwork regarding the day itself, so we go through all of that so they know exactly what time to arrive, whether they can eat and drink, what drugs to take. They're the three sort of main questions that the patients have. People are often concerned about the procedure itself and the safety of it. This is a very commonplace procedure nowadays, done under very controlled conditions by very skilled people. So it's a very safe procedure, and at the end of the day we're getting a diagnosis, and then we can go about starting the appropriate treatment for the patient. After the pre-admission clinic, I correlate all the information that I've gained. I check all the blood results on the patient, and I just want to see that they're, again, clinically fit to undergo the procedure. If there are any problems I've highlighted, I may need to discuss them with the appropriate consultant. Sometimes we have to cancel the admission and reschedule it at a later date. For instance, if the patient's anemic, we can't go ahead. We need to get that sorted out beforehand. And there are other various reasons as well why it might get cancelled. It isn't the end when they've finished pre-admission clinic. They can always give me a call if they're concerned about something. So they do have a link there.
When you've had your pre-admission interview, you'll be given a date for the procedure. When you come into hospital, usually for a day, one of the team will come and talk to you. They'll be able to answer any questions and ask you to sign some basic paperwork.
Well, they've told me that they're going to pump some ink into my veins. The ink is going to go around my heart, and that's going to show up any damage. No.
The radiographer and nursing staff will also tell you about the details and prepare you for the procedure. There are plenty of people inside and outside the operating theatre who are able to make sure the procedure is carried out safely and
I
comfortably.
can get you to keep your hands where they are now. I'm about to cover you in some sterile. The patient doesn't like jazz either.
Now, Fred, you all right under there?
Yes.
Perfect. You okay, yeah? Good. And so what we're going to do now is we're going to feed up this catheter, take some pictures of the left side of the heart. We have to take quite a few pictures because, as you can appreciate, my fingers are V'd there, but in fact you can't appreciate it there or there. So there are a number of X-ray projections we take to allow us to use this two-dimensional method to visualize a three-dimensional problem. So we're just going to take some pictures. That's great. And left lateral, please. So as you can see, the X-ray machine is able to move around the patient. We don't have to move the patient, which allows us to take multiple projections. That's good height. That's good. Gives us that visualization that we need. Now just turn your head to the left slightly, Fred, now, please. So we're just going to connect onto a pressure injector now. This delivers a fixed amount of X-ray material. So this allows us to visualise the pumping chamber of the ventricle and make an assessment of how good the heart function is. Right, Fred? Right. Breathe in. And inject, please. And breathe normally. Well done. We're all done. I'm going to have a good look at these pictures now. And then come and chat with you outside, all right? Yeah. Perfect.
Oh, I feel perfectly all right. Yes, yes, very good.
No pain.
Very good, no pain at all. I'd sooner have that than go to the dentist now it does help me, so.
Generally, following the angiogram, your cardiologist will come and explain the findings of the procedure to you. There are a number of possibilities. Firstly, the arteries may be normal and require no additional treatment. Secondly, there may be minor narrowings requiring medicines. Thirdly, there may be important narrowings that need to be treated with either angioplasty, involving balloons and stents, or a bypass operation. If you require angioplasty, that will be performed in the Royal United, whereas bypass surgery would usually require a referral to Bristol. We hope, having seen this film, that you'll agree that an angiogram is a simple and straightforward procedure and really not anything to be worried about. After a few hours, you'll be able to get home, and after a few days resume normal activities. We look forward to seeing you at the pre-admission clinic and getting you back on track for a normal, healthy life.